Hi everyone and welcome back to Health Made Simple. Today we're talking about a topic that many women discuss in whispers if they discuss it at all. Have you ever noticed a strange fishy odor and immediately thought, did I sit on a dirty toilet? In our part of the world, we often call this a toilet infection. But in the medical world, more often than not, it's actually bacterial vaginosis or BV. It's not about being dirty. It's about an ecosystem out of balance. Stick around to know more because understanding the real causes, including a very surprising one, involving antibiotics, is the only way to find a permanent solution. To understand BV, you have to understand that the vagina isn't a sterile, empty space. It's a thriving ecosystem like a forest. In a healthy forest, you have good bacteria called lactobacilli. These are your protectors. They produce acid that keeps the environment healthy. BV happens when the balance shifts. The protectors decrease and bad bacteria, the weeds, take over. It's not an infection you catch. It's an imbalance of what's already there. So why does the balance flip? Most people think it's a lack of cleaning, but it's often the opposite. This is the overcleaning trap. Using strong antiseptic liquids, medicated soaps or douching, which is washing inside, kills your protector bacteria. This gives the bad bacteria a chance to take over. Scented pads and vaginal perfumes also irritate the lining and change your pH. And while it's not an STI, a change in partner can introduce new chemistry that disrupts your natural balance. Now, here is a cause many people don't know: prior antibiotic use. Evidence shows that when you take broad-spectrum antibiotics for a throat infection, a UTI, or a wound, the medicine doesn't just stay in one place. It travels through your whole body. While it's killing the bad germs making you sick, it also accidentally kills the good lactobacilli in the vagina. When those protectors are gone, the vaginal pH rises, creating the perfect environment for BV to flare up. This is why many women notice symptoms starting shortly after finishing a course of antibiotics for something completely unrelated. It's a medical paradox. The cure for one thing can be the trigger for another. Before you treat it, you must know what it is. The smell of BV is strong and fishy, especially after sex or a period. Yeast usually has no smell. The discharge from BV is thin, watery, and grayish-white. Yeast is thick and white like curdled milk or EBA. And the feeling? Yeast is famous for intense itching. BV is often just about the smell and discharge. If this sounds like you, please don't use herbal mixtures. See a healthcare professional. They may check your pH or look at a sample under a microscope for clue cells. If confirmed, they will likely manage it with prescription-only antibiotics, either tablets or gels specifically for BV. The rule is you must finish the full dose. Even if the smell goes away in 2 days, the bad bacteria are still hiding. If you stop early, they will grow back stronger. To keep the peace in your inner forest, plain water on the outside is all you need. Wear cotton underwear. It lets your skin breathe and prevents the moisture that bad bacteria love. If you are on antibiotics for another illness, ask your doctor if a probiotic can help protect your vaginal health. BV is a sign your body needs balance, not shame. If this helped you, share it with a friend. Let's end the toilet infection myths together. Stay healthy, and I'll see you next time.